This video will show you how to properly stop your TPN infusion and dispose of supplies. Please follow all instructions shown in this video. Stopping your TPN can be safe and easy with proper instruction. Your home health nurse will be available to instruct you on the procedure following discharge and will visit weekly and as needed for your catheter dressing change and any labs that your doctor has ordered. You will know it is time to stop your TPN infusion when the pump beeps 9 times and begins infusing at the kVO rate until the stop button is pressed. Please begin by preparing your work surface by cleaning the area thoroughly with soap and water or a disinfectant wipe, and drying thoroughly as well. Wash your hands thoroughly for at least 20 seconds. And dry as well. Use a separate towel to turn the faucet off. Gather antiseptic wipes, saline syringes, and heparin syringes for flushing, and any other supplies as directed. Prepare both pre-filled syringes of sodium chloride, also known as normal saline, and heparin, if indicated, by holding the syringe with the tip in an upright position. Gently pull back on the plunger, then push forward gently on the plunger to expel any air that is in the syringe. Do not touch the tip of the sterile syringe. Repeat with each syringe. Open the backpack. Remove the CAD prism pump. Press the Stop-Start button on the CAD prism pump located on the left side below the pump screen. The pump will ask if you want to stop the pump. You will press the Y button for Yes located on the right side below the screen. Close the clamp on the tubing. Disconnect the tubing from your injection cap. Use a coin to unlock the tubing and administration set from the pump and discard the tubing and the TPN bag in an appropriate container. Press the button on the battery door and slide the battery door forward. Remove the used battery. Set the battery aside and replace the battery door. Remove the power pack from the pump and charge according to the power pack instruction sheet. Discard the tubing and the TPN bag in an appropriate container. Scrub the hub of your injection cap vigorously for 30 seconds with an antiseptic wipe. Allow to dry for 60 seconds. Attach the pre-filled syringe of sodium chloride to the end of your injection cap by pushing and turning clockwise to secure the syringe in place. Flush the catheter with the prescribed amount of sodium chloride as directed by your nurse, using a push-pause method. Disconnect the syringe. If your catheter requires the use of heparin, scrub the hub of your injection cap again with a new antiseptic wipe for 30 seconds. Allow to dry for 60 seconds. Attach the pre-filled heparin syringe to your injection cap and flush the IV catheter using the push-pause method. Disconnect the heparin syringe. Supplies and syringes can be double-bagged and disposed of with your household garbage. Wash your hands thoroughly for at least 20 seconds and dry as well. Properly stopping your TPN at home is important to your safety. Please call 1-800-755-4704 if you have any questions or concerns at all while administering the medication. We are available 24 hours a day, 7 days a week. In the event of an emergency, always call 911.